Thank you for joining us for this special edition of KPBS News. I'm Amitha Sharma. Local health officials are cautiously watching an uptick in coronavirus cases and hospitalizations. That's among this week's headlines. San Diego's cases are expected to pass 12,000 this weekend, with more than 350 deaths since March. At the state level, a budget plan to fill a $54 billion deficit is expected to be passed by the state assembly. Spending cuts will be made to courts, colleges, and state worker salaries. Locally, MTS announced it will restore service to pre-pandemic levels starting Monday. And county supervisors voted to ask the state for guidance on resuming planned events like wedding receptions and hotel conferences. Two prominent local politicians say they will self-quarantine after being exposed to COVID-19. County Supervisor Nathan Fletcher and State Assemblywoman Lorena Gonzalez say they tested negative, but were in contact with someone who tested positive. The two are married. Fletcher has been a face of the county's COVID-19 response as a co-chair of the county's task force. The health crisis is also an economic crisis, evident in the demand for food assistance. The San Diego Food Bank's workload has doubled in recent months. KPBS reporter Matt Hoffman shows us how it's meeting the challenge.
So we have 500 nonprofit partners. We're taking 35 of them to make them high volume, high frequency distribution sites.
Thanks to donations to the Food Bank's COVID-19 response fund, they're creating about 3 dozen of these super food pantries countywide.
Thank you so much.
Awesome job. Today, the Food Bank gave out checks to its nonprofit partners who will run these beefed up distribution sites.
So what they have to do is they have to distribute at least 3 days a week and do that until December 31st. In return, they're going to get as much food as they can distribute. We're going to push so much food to them, and then we're giving them capacity grants of $20,000 to help build their infrastructure. Congratulations.
Thank you,
and you get the banner too.
One of the nonprofits running one of these super pantries is Jewish Family Service.
Would you like us to load the back seat or in the very back?
The numbers have just skyrocketed, so we're seeing a really large increase, and people are coming through on a daily basis to our drive-through. We're serving over 1,000 meals a day through our drive-through.
Yeah. You're all set. Have a good day. Enjoy.
Thank you. JFS officials say many people are coming to their food pantries for the first time, but for others during the pandemic, this resource is helping now more than ever.
People really don't realize how hard it is, just even for simple things like food. So we're a family of 3. I have an 8-year-old son. And we're so thankful to this, so thankful.
Kari Mata says her husband recently lost his job, and this extra food goes a long way.
Programs like this make such a difference for families. And like I said, for the last few months, this has been a savior to us.
The food pantries provide fresh fruits and vegetables, as well as breads and other dairy products. Mata was even able to pick up some dog food for her brown lab.
Yes, and they saw my dog and they said, do you want food? And it's science diet, it's good food too, so that was awesome.
Travel safety, thank you for coming.
The food bank was previously doing large-scale distributions at places like SDCCU Stadium during the pandemic, but these super pantries will take their place.
We learned that the mass distributions, they really lack client dignity. And so that 1,000 you can serve, but 3,000 get turned away, they wait in line, they don't get food. So this is a grassroots approach. It gets people in their neighborhoods where they can go, a trusted partner, they get the food they need to feed their family with complete client dignity.
To find a food distribution site near you, call 211. Matt Hoffman, KPBS News.
One of our iconic tourist destinations, the Hotel del Coronado, reopened this weekend. It's one indication that travelers are returning to San Diego. KPBS reporter Eric Anderson shows us how the airport is trying to reassure flyers that San Diego is a safe destination.
People are starting to return to San Diego's biggest airport, and they're getting a lot of reminders, like these on elevators, about safety in the age of COVID-19.
Of course, the doors open right away. We have the floor decals that also encourage social distancing.
Masks are required when people are indoors, and nearly everyone complies. And there are plenty of stickers encouraging hand washing and social distancing.
And we understand that when you're in the airport, there are things that you have to touch, whether it's a kiosk when you're checking in or a handrail on the escalator. And so we have our cleaning crews coming around on a constant basis, cleaning all the high touch points.
Passengers have been flying more of late. Marketing Vice President Hampton Brown says airport passenger traffic was down 95% in mid-April because of the coronavirus. Current numbers are down 80% from a year ago. Activity at ticket counters backs that up. Things are not crowded, but there is steady traffic.
We have approximately 30% of the flights we do in a normal month, but airlines like Southwest continue to add more capacity as they see booking patterns increase.
Airport officials are also optimistic about surveys that show that more passengers may be coming San Diego's way because there's pent-up demand. People are interested in visiting San Diego's beaches. Eric Anderson, KPBS News.
The COVID numbers aren't just rising in California. States like Arizona are setting records and packing ICUs. And that's a concern, as summertime means many Arizonans are coming here to visit. More now from KPBS reporter John Carroll.
Tourists visiting San Diego County primarily get here in one of two ways. They fly in or they drive. A good portion of tourist traffic on Interstate 8 is coming from Arizona, and when it comes to COVID-19, our neighbor to the east is in deep trouble. In Yuma, they've seen their COVID cases jump 300% in less than a month. The situation isn't much better in either Phoenix or Tucson, and that brings up an uncomfortable question. What about Arizonans making the drive west on I-8? So now, two competing concerns are coming into focus. The need for San Diego's tourism economy to rebound, and the desire for all of us to avoid contracting COVID-19. The problem is, are those Arizona tourists bringing disease with their dollars?
I think there's not a definitive way forward because there's really these two forces that are in conflict with each other.
Carl Winston heads up San Diego State's School of Hospitality and Tourism Management. He says places like Hawaii and the tri-state area of New York, New Jersey, and Connecticut have all instituted 14-day quarantines for people visiting from states that are experiencing spikes in COVID. But he's not sure that would work here.
I think they can legislate away, John, but I'm not sure they can enforce. And it's a real conundrum for society.
I asked whether officials here are concerned about people driving over from Arizona and possibly bringing COVID with them. The answer? Anything that would be done about that would have to come from the state. John Carroll, KPBS News.
KPBS also asked Governor Gavin Newsom about the rise in cases in Arizona and if California would impose a quarantine order. Here's some of the governor's response.
We don't at this time we don't believe at this time that is necessary. That said, I want to make this crystal clear. It's been the case in the past, because this question has been asked not just yesterday but months ago, that when you do come into the state of California, you're responsible to advance the rules within the state. Meaning, when you come into the state of California, you have to wear a face mask. When you come into the state of California, you have rules and regulations and health guidelines that have to be enforced, and we expect will be advanced. And so I think the message should be very clear. Anyone coming into the state of California is subject to the mask mandate and the guidelines that we have put forth. But at this moment, we're not shutting down our border to other states.
You can see just how many cases of COVID-19 are happening in your area. Communities in the South Bay are at the top of the list. To see COVID-19 cases broken down by zip code, look for the Tracking COVID-19 section at kpbs.org. It's another side effect of the coronavirus pandemic, a spike in human trafficking that targets children who are spending more time online. KPBS education reporter Joe Hong spoke to investigators and advocates about what parents can do to monitor their kids while school is out.
If you really think about this as modern-day slavery.
It seems counterintuitive that reports of human trafficking are up while everyone is sheltering in place. But Detective Dan Deerdorf with the San Diego Human Trafficking Task Force isn't surprised because many minors have been at home spending more time on their phones and social media.
Social media is, it's good, but it has its downfalls where you have a lot of catfishing going on, which is they're representing somebody else who, to the victim or survivor, and they start promising them things like, I promised you, you're so beautiful, you're so cute, you're smart.
According to the San Diego County District Attorney's Office, reports of internet crime against juveniles in the county, which mostly involve sharing illicit photos of minors, have tripled since the pandemic started. In April of 2019, there were 287 reports in the county. This April, the number shot up to more than 850. The local spike mirrors a trend throughout the United States and across the world.
It's due to a variety of factors.
Rebecca Sternberg oversees the cyber tip line at the National Center for Missing and Exploited Children. In April 2019, the National Tip Line received about 1 million reports of child exploitation online. This April, the center received more than 4 million reports.
With kids being home and parents being at home due to stay-at-home orders, schools being closed, children just have more access to being online, more access to kind of devices that get on the internet.
Deerdorf's team, which focuses on sex trafficking cases in the San Diego region, conducted 12 rescues between March and May of this year. That's more than double what they did during the same months last year.
Let's say we received a report from a parent and concerned that their child is leaving home a lot. They come home with more than one phone. All of a sudden they have money with them. They come up with clothes. Their boyfriends are older. They're going to hotels. They're going out quite a bit. And there's no explanation for it.
Even before the pandemic, human trafficking was a top priority for local law enforcement. As a border region, San Diego County is especially vulnerable. District Attorney Summer Steffen said her office has focused on prevention.
We simply don't talk to our kids about these issues, and that's why they're kind of sitting ducks for exploitation.
Last year, Steffen's office launched the San Diego Trafficking Prevention Collective, which created a curriculum to help children detect when someone is trying to exploit them online.
All of the different buzzwords, the information that is subverted, like lots of times in the world of investigating these cases, they'll use roses instead of money. That's a communication of trading sex for money.
Steffen says local investigators have to keep up with the constantly changing methods of perpetrators, but she said social media platforms aren't doing enough to help.
The social platforms, they don't really adjust. They're looking for huge red flags that by law they have to intercept, and they're not looking for subtleties that we know about in law enforcement.
Deerdorf says the fight against these crimes begins in the home. During a time of social distancing, he said it's more important now than ever for parents to make sure their kids feel cared for at home so they don't become vulnerable to the flattery that leads to exploitation.
A lot of it is the responsibility of the parents. Again, I think the most important thing for us as individuals as a whole is just communication with each other and opening up and finding out what the other person's going through, because if you can't gain the trust of individuals in your family or individuals in your community, then you're losing half the battle.
If you suspect that a minor you know is being exploited online, you can submit a report at report.cybertip.org. Joe Hong, KPBS News.
UC San Diego is mapping out plans to bring students and faculty back to campus this fall while preventing the spread of COVID-19. Stephanie Elam shows us the university's ambitious testing program.
It's just really exciting to be a part of this.
UC San Diego student Eleanor Gruden didn't prepare for this test, but it might have the greatest impact on her education next term. She's taking part in the pilot phase of the University of California at San Diego's Return to Learn program. The eventual goal? To test the university's population for COVID-19 on a consistent basis for 8 months, beginning in September, potentially paving a path to return to some in-person education in the fall.
We want to be able to come back in the safest way possible, and one of the key features of that is to be able to monitor for presence of the virus.
By following clearly posted directions, Gruden is collecting her own sample.
We're planning on having all around campus a bunch of collection boxes, each of which would contain a stack of individually wrapped swabs with medium. Each swab would have associated with it a QR code. We'll have loaded on the UCSD app a barcode reader that will attach the identity of the person using the swab. They will pop the barcode, pull the swab out of the sleeve, swab their mouth, stick the swab back into a a plastic sleeve and then drop it into a box.
It was way better than I thought it was going to be.
Every 2 to 3 hours, researchers say these boxes are taken to the Center for Advanced Laboratory Medicine.
Our goals are to try to provide results within a 24-hour time period.
What is the most difficult aspect of adding on this layer of COVID-19 testing?
It's hard to get materials to do the COVID testing, and it's hard to get enough people to do every single step of the process.
We have a couple of months to scale up to the degree we need to. Does the testing replace masks? No. No, it's just one part of it. Until this either burns out, which chances are is not going to happen, or until we're pretty much immune from a vaccine, we'll have to be extra careful.
While the pilot program was focused on about 5,000 people who remained on campus after it shut down, at full speed, UC San Diego will need to regularly test its community of 65,000 students, faculty, and staff.
The simulations indicate that if even 75% of the population were tested per month, we would still be able to detect an outbreak before there were, say, about 15 detectable infections on campus. The secondary component, which is really critical, is what we do once we identify the outbreak. That's where we're going to rely heavily on measures such as contact tracing and isolation and quarantine and social distancing interventions.
Test results pop up in the app. And so far, students seem game to participate.
It provided us all a sense of comfort to know that none of us were carriers.
Especially if it helps get their peers back on campus.
That would be amazing, because a lot of college is what you learn in the classroom, but so much of it is also your experience.
That was Stephanie Elam reporting. UC San Diego researchers said the program would cost the university about $2 million a month to test 65,000 people. Some San Diego scientists have zoomed in on the coronavirus and found a picture that isn't very sweet. KPBS science and technology reporter Shalina Chatlani says the virus is coated with a sugary exterior that makes it hard for the human body to fight.
Most of us have seen a photo of the virus, a giant sphere covered in spiky proteins. Well, it turns out those spikes are covered in sugar, says UC San Diego chemist Rami Amaro.
And it's those spike proteins that are really the main infection machinery of the virus. And these are the bits of the virus that get really heavily decorated with this sugary coating so that our immune system can't detect it in the body.
Many cells in our body also have sugar coatings. Amaro says viruses, like the coronavirus, have adapted to be covered in sugar so they can blend in and survive and be more infectious.
The human system thinks it's just sort of similar to what should be in the body and then doesn't attack it.
The existence of this coating is well-known research, Amaro says, but what's new is that her lab used a supercomputer to zoom in on the virus and figure out what these sugary spikes actually look like.
There are some holes in the shield, and these are so-called vulnerabilities. And this is why it becomes really important to know what it looks like, because if we can identify where those open areas in the shield are, it gives us a better chance to potentially design neutralizing antibodies.
Amaro says the research will help with vaccine and antiviral design so that they are more effective. Shalina Chatlani, KPBS News.
That story by Shalina was one of our most read this week on kpbs.org. That's where you can find all of our local stories, shows, and podcasts. Just click the Tracking COVID-19 link on our homepage. Coronavirus has reminded the world about the crucial role of healthcare workers, especially nurses. KPBS health reporter Taryn Mentos says another crisis outside hospitals is again calling those professionals to the front lines.
A team of registered nurses prepared for their jobs on a weekday afternoon by assembling the new gas masks they ordered online. Critical care nurse Christina Kelly helped her colleagues attach the magenta filters.
So they point up directly like that, and then down.
The respirators are part of their toolkit not for the hospital, but the streets. The group has become a regular presence at ongoing protests over racial injustice and works with street medics to provide licensed care.
So they'll radio or text us if there's somebody in the crowd that needs assistance.
Kelly, who holds a doctorate in nursing practice, launched the volunteer task force to ensure everyone had access to aid.
As a nurse, we can't just take care of people that are in the hospital. We're also responsible for the communities that we serve, the population.
Kelly saw the need firsthand back in late May. She attended a downtown San Diego protest against police brutality to watch what was going on. Protesters ran when police used flashbangs, pepper spray, and rubber bullets to disperse crowds. And Kelly was concerned as a medical responder.
I just saw all of these hazards, like people could trip, they could fall. I saw head traumas. We didn't actually see head traumas, but you can see that in the making.
She feared the sheer size of the crowds and the road closures meant emergency response teams couldn't reach someone if they were in need. She rallied her colleagues to put licensed professionals on the ground at as many demonstrations that they knew about. They're now invited directly by organizers who are often in their teens and 20s.
So they started seeking us out when they would see us there.
So far medically, Kelly says injuries have been minimal.
Dehydration, it's been exhaustion, it's been sun exposure, heat exhaustion. So where we've had to give water, we've seen bike falls because there are some demonstrators that are on bikes and skateboards.
And they've distributed masks and hand sanitizer to keep people safe during the pandemic. But their backpacks are prepared for any situation with the supplies that they provide themselves.
Scissors, ponchos, Band-Aids, steri strips, saline wash.
Kelly notified her employer and the San Diego chief of police about the role they'd serve. The American Nurses Association California chapter endorsed the task force and used Kelly's letter as a template for nurses across the country.
So that any other nursing task force that wants to write a letter to their local chief of police to let them know of their intentions to be present at demonstrations, that they have a platform to do so.
Task force member Laura Chechel says they don't only walk behind demonstrators to provide care, but to support the fight against racism. The American Nursing Association's Code of Ethics says nurses have an obligation to social justice to reduce health disparities.
Our voice is valued by people. You know, when you say you're a nurse, people sort of listen to what you have to say. And, you know, you need to get out there and you need to speak up for what's right and what's appropriate in your communities.
A recent demonstration in City Heights included task force member Nicole Ward's own daughter.
It's better when she's with her mama than out here by herself.
19-year-old Kiara Ward says her reason for marching is simple.
I'm a cosplayer, so I get a lot of hate because of my skin color. So I often get called the N-word a lot, and I want to protest because I feel like I have a right to just exist without being hated on.
Demonstrators have marched against that kind of injustice for weeks in San Diego. An early June protest drew thousands that filled streets on an hours-long trek through the city. A KPBS reporter was live streaming the event online when a young woman collapsed.
We might have an emergency here or something.
The location and sea of people made it difficult for emergency responders to reach her. Kelly and the task force were there and rushed in.
That medical team that we were just talking to, they are working on that woman right now.
Taryn Mento.
She was talking to them and they're about to help her up.
KPBS News.
The NCIS Miramar Air Show is being grounded due to the pandemic. Base officials say it's a disappointment, but the safety of the Marines and the public comes first. The last time the air show was canceled was in 2013, when the Department of Defense slashed budgets during the government shutdown. Officials hope to bring the show back next year. And Major League Baseball announced that the Boys of Summer will play ball after all. As for what that means for the Padres, the fans, and the nearby businesses, we sent KPBS reporter Matt Hoffman to find out.
So there is going to be a baseball season after all. Major League Baseball is telling us that the season will start on July 23rd or the 24th. Today here in downtown San Diego, Padre players already out there taking batting practice at Petco Park. Now, if you're wondering why, that's because spring training is going to be held here at Petco Park. The Padres telling us players will report for spring training on July 1. You can see people out here at the park already out here checking out the Padres players, the first glimpse they're seeing of them in months. Now, Padres officials telling us, though, people won't be able to be inside to watch the games.
Trying to make sure that everybody understands the importance of, following, any kind of measure we can to limit your exposure, limit your risk.
Even though there won't be any fans inside the stadium during games, many are just excited at the thought of baseball coming back.
I wish we could be in there because we're season ticket holders, so it's been miserable with all this COVID going on. Like, it's just been stressful, nothing but working. We can't really go out. So now that we get the chance, we bring our son since they opened the park.
I'm excited about it. Hopefully the players are happy with it too. Hopefully it'll bring something to the game, to the community locally.
162 games is a normal season, but as of now, there's plans for just a 60-game season. Business owners near Petco Park are also welcoming news of the shortened season.
Downtown's it's been pretty slow.
While restaurants aren't expecting the usual game day rush, eateries like Social Tap are hoping games will give people a reason to just come downtown.
We got a great spot here that's as close as you can get to the ball game, so I feel that if people are going to come down and want to be kind of part of that energy and that buzz, we're a prime spot for that.
Ladies and gentlemen, welcome to Petco Park for tonight's game featuring the San Francisco Giants and your San Diego Padres.
Speaking of vibe,
I'm that voice you hear from the moment you walk in the gate all the way through first pitch and all the way through the last out.
Padres public address announcer Alex Miniak has been waiting for the return of baseball.
I'm very excited. I know things are going to be different than any other season I've ever done before. Still a little wait and see there.
Even though no fans are expected inside the stadium, Miniak still wants to get back behind the mic. He says it's all about the atmosphere.
We should try to keep everything as close to normal as we can for those that are playing.
That means we could be hearing more of this.
Fernando Tatis Jr. I can't wait to get back to saying that.
Padres officials say they're still working on figuring out what the game day and broadcast experience on TV will be like. Matt Hoffman, KPBS News.
That's all for this special edition of KPBS News. For all of us here at KPBS, I'm Amitha Sharma. Thank you for joining us and stay safe.